Welcome. I'm Tanya from Simple First Aid, and thank you for booking onto one of our courses. So this video is for the blended paediatric first aid for nurseries. So this is the second part of your course. You've already attended your practical session, and now it's your time to go through this video. That's going to be some of the questions from the practical day, and you'll have a 10-question test to do after this video. The test has 10 questions, and if you get any of them wrong, don't panic, you can always do the test again. So you have a few opportunities to get it right. Now let's jump to it. So the first topic we're going to talk about is our primary survey. So that's the most important thing probably much on the course. So we're going to be covering how to treat a unconscious and breathing and unconscious and not breathing casualty. So the most important thing you need to check for is danger. So your surroundings in the area. So what can you see? So there's lots of dangers in your nurseries. So other children, furniture, maybe stairs, outside equipment. So you've got lots of dangers. So you always need to assess before you go in. You are the most important person, so make sure yourself is safe. Then the second thing we need to do is shout for help. So we don't want to be alone in this situation. So call for one of your colleagues to come over to help you, and also maybe call their emergency services. Then if we see a child lying on the floor, then we need to try and see if we can wake them. So we will tap their shoulders and call their name. So we're looking for a response. So try and wake them up. If we do not have a response, now we need to open their airway. So place your hand on their head, 2 fingers under the chin. You tilt their head back, and you're going to be checking for their breathing. So you can also peer into their mouth to see if there's any obstructions. If not, you're going to place your head next to their face, and then you're going to use 3 of your senses. So can I hear it? Can I feel it? And can I see it? So that's what you're looking for, their breathing. You can do this for 10 seconds, and then you can give your colleagues more information about are they breathing or not, and then whether the emergency services need to be called. If they are breathing, then you'll move them onto the recovery position. So move them onto their side, and then we're going to check for any other injuries. So if there's any bleeding, so that's what the circulation part of the Dr. ABC is for. So check around to see if they've got any other injuries, and then we can treat those from there. But breathing always comes first. Now, if the situation is slightly different, so if they're not breathing, what we need to do is, again, check for dangers, check for the response, call for help, open their airway, check breathing again, and this time they're not breathing. So we need that ambulance on the way as soon as possible. So then we're going to tilt the head back. We're going to initial 5 rescue breaths. So we're going to inflate the lungs, make sure the air goes in, and then we're going to use one hand, the heel of the hand, into the center of the chest, and we're going to give 30 compressions. Once we've given 30 compressions, we'll then tilt the head back again, and then give 2 breaths, and keep continuing until help arrives. If you do feel that you start to get tired, then you can ask your colleagues for help. Excuse me. So you ask your colleagues for help, and then you keep going until help arrives. Our next topic is fevers. So you deal with this quite a lot in your nurseries, and you probably are experts in it. So the most important thing is to check their temperature first. So a healthy temperature range for a baby is between 36.5 and 37.5. So they may vary a degree or 2, but that's generally a healthy range for a baby. So 0.5 degrees, we're going into fever stage. So what you'll see, they'll be red and flushed. They might be quite clingy. They might not be themselves. They might be lethargic or tired. So we need to check their temperature, remove any excess clothing, keep them hydrated with water or diluted juice, and then give them recommended doses of paracetamol or ibuprofen syrups. Alternate the two, and obviously check with the parents first and give them a call to see that that's okay. Moving on from fevers, we're going to talk about burns. So burns, there's lots of ways you can burn yourself. It is a very common thing that we see in the home, and it also can happen in the nursery too. So obviously you've got the kitchen, and then you also may have electrical appliances around your nursery too. So if a child does burn themselves, we need to cool it with cold running water as soon as possible. So get it under the tap or shower, and for 20 minutes minimum, and then once it's completely cooled, and we're going to apply cling film to keep it clean and stop infection. But the main important process is cooling it with cold water as soon as possible. And then we do recommend that all children and babies do go to hospital to get checked out. So then I would call the parents and advise them to take their child. Our next topic is nosebleeds. So again, quite a common one that can happen in the nursery if two children collide, or if they fall over and bump their nose, or even if it's toddlers just learning to start to walk, or babies learning to walk. So what you'll see is it may be swollen around the nose, obviously blood coming from the nose. They may be quite distressed and quite scared if it's their first nosebleed. So what you do is grab some tissue or a tea towel from the kitchen. You'll lean them forward, pinch the soft part of the nose and hold it there for up to 10 minutes. Normally a nosebleed stops after a couple of minutes, but if it doesn't, then what I want you to do is keep holding it there for 10 minutes, check, another 10 minutes, check, another 10 minutes. So up to 30 minutes. If it's still bleeding after that, then there's something seriously wrong and we do need to take them to hospital. But generally speaking, they should be able to stop within at least 5 minutes at the longest. If you can try and encourage the child not to pick their nose or have any hot drinks after they've had a nosebleed, because that could dislodge the clot and it could bleed again. So in a few days, the blood should disappear and they're back to normal. So what a nosebleed is a burst blood vessel inside the nose, and it caused by generally knocking or a bang to the face, or maybe even contact sports or playing on a playground when they're a lot bigger. It can also happen when for no reason, or for heat, or people that are travelling. So there's a few reasons why a nosebleed can happen. Leading from nosebleeds and burns, I want to now talk about shock. Now, shock is a medical condition that is life-threatening, and it's really important for you to know the signs and how to treat it. So what you'll see, if somebody's going into shock, it's caused by 5 things and 5 things only. The first thing is bleeding, so loss of blood. The second one is if they've severely burnt themselves. If they've broken a bone, so it could be leg or arm, or anywhere, any bones in the body. Also, it could be caused by severe dehydration and severe diarrhea and vomiting. What shock is, it is not enough oxygenated blood getting to the brain. So what we need to do if we see somebody going into shock from one of those 5 things, we need to lie them down, keep them warm and raise the legs. So what they look like when they're going into shock is they're going to be pale, cold and clammy, because all the blood is now going to the vital organs, so pulling them in. So the outer extremities are starting to get cold. So cold and clammy, like damp skin. They're going to feel quite nauseous, so they might vomit. Their breathing's really important, so it's going to be shallow but really rapid, because the heart is working really hard now to try and pump blood back up to the brain, because the brain is not getting enough oxygenated blood. So as I said, we need to lie them down, raise their legs, keep them warm, keep talking to them, and keep checking on them. It's really important that you stay with them and monitor them, because they can go unconscious. So if they do go unconscious, then you bring their legs back down and then you put them into the recovery position, the position we learned earlier. So roll them onto their side and tilt the head back. Always update the ambulance if it hasn't arrived. So if they've cut themselves and you're waiting on an ambulance and then they go into shock, then you need to update the emergency services, so that means you're more higher up on the priority list. And then if they go unconscious, then put them into the recovery position and keep monitoring them. And if they do deteriorate any further and stop breathing, then you need to roll them back onto their back and then administer CPR. And our last question is meningitis. So it is a medical condition that is here in the UK. Your children can get vaccinated against it, and also they're doing more vaccinations in universities and for adults as well. It's an infection that affects the brain and the spinal cord. There's two types of meningitis, there's bacteria and viral. It's highly contagious, so if there is an outbreak of meningitis in your nursery, then you will need to contact Ofsted and the HSC. So what we'll see if a baby is experiencing signs of meningitis, first off, you'll see flu-like symptoms and high temperature. They will have cold hands and feet. They will have a high-pitched cry. They will refuse to feed, and they will, a rash may appear or may not. Please don't wait until the rash appears. That is the final stages, and then their treatment might, we might not have caught it quick enough. So if you see the bulging fontanelle, so also a lump on the head that sticks up, so that bit that pulsates at the top, if that pops up and starts to bulge, then, and a high-pitched cry, that is the two key main symptoms for a baby experiencing meningitis symptoms. So we need to call 999 as quickly as possible, call the parents, and also segregate them from the rest of the children. Also, maybe you want to put on gloves and a mask to protect yourselves as well. Symptoms for a child for meningitis are slightly different. So you'll see flu-like symptoms and a high temperature that's the same as a baby. Then you might experience a stiff neck and sensitivity to light. So as the infection starts to move down from the brain, it will also affect the neck, that will cause the neck to stiffen, and sensitivity to light, and maybe some headaches as well. And then the rash may or may not appear. The rash can be anywhere on the body, and it will be purpley red spots, so please check. And you can also use the glass test. So a normal glass, you roll it over the rash, and if it doesn't disappear, it's more than likely that it's meningitis. Again, you need to act quickly, segregate the child from the rest of the children, and call 999. And don't forget to inform Ofsted and HSC. So those are some questions from the course. So now if you go over to click the link, and then you can fill out the test. It's only 10 questions, and then we'll submit your results. Excellent. So thank you again for booking with Simple First Aid. Hopefully you enjoyed the course, and we look forward to seeing you soon.